everyone. So today it's all about balls. Not footballs, not basketballs, but testicles. Let's talk about you and your testicular cancer. Last year I was very surprised when I was reading into this, and I found out that testicular cancer is not a cancer of older people. 90% of all the cases of testicular cancer occur between the ages 15 and 45. That's very young. Then I also found out that testicular cancer is one of the most curable cancers we have out there. The cancer is a very complicated disease to deal with and to cure because it's not an organ-specific disease, it's not a system-specific disease. Like many other diseases, if you think of a heart attack, that only happens in the heart. Cancer happens in any part of the body at any time and to anyone. That's why there's a lot of research that goes into it. With cancer, there's no one main thing that leads to cancer occurring. There's what we call risk factors. There's risk factors that when they come together can eventually lead to cancer. So if you think about it like building a wall, and let's say the wall is cancer, you need bricks to build that wall. And it's like, those are the risk factors. If you have one brick, if you have two bricks, it's not really a wall, but it means you're closer to being the wall than if there weren't any bricks. So that's what risk factors are. They're things that when eventually they come together, they do build a wall and they do lead to a cancer. So every cancer has its own specific risk factors. So we're going to talk about the risk factors that lead to testicular cancer. So the main one being very obvious, sex. The male sex. If you have testicles, you're at higher risk of getting testicular cancer. Duh. Age. So I've already said this. The main age that most of testicular cancers occur is between 14 to 45. The second one is genetics. So genetics, if you have a family history, of maybe your father or brother having testicular cancer, it means that's another brick, that's another thing that gets you closer to getting testicular cancer. Another one is ethnicity. So studies have shown that within the Western Caucasian population, they have the higher cases of testicular cancer. This does not mean that if you're not Caucasian, you're not going to get testicular cancer. It just means when you're in this group, this ethnic group, you're just a little bit higher. You have a higher chance of getting testicular cancer than other groups. Next is undescended testicles. So this is something that's usually diagnosed and fixed when you're younger. And environment. This is very true for most type of cancers. The environment we're in plays a big role in the formation of cancers. And also, the last one I have down is hormones. Hormones also play a part in this. So these are the risk factors that are associated with testicular cancer. So it's very clear what the risk factors are, and it's also very clear that this is a curable cancer. So I was also very surprised to find out that there's usually a delay in the diagnosis and the treatment of testicular cancer. And studies have shown there's basically two factors that lead to this, and the first one being lack of awareness and knowledge. People just not knowing that they're at risk, people not knowing that their age is a risk factor, people not knowing their family history is a risk factor. The second aspect, which is, I think it's more of a societal issue, is that males are reluctant to go to the doctor. They're reluctant to go and basically say, "Doc, something's up with my testicles." There's something, whether it's part of a masculinity problem or it's just something that's not spoken about. Males are reluctant to go and seek medical advice. So these two come together means people are not presenting to the doctor, they're not going to seek medical advice, it's not getting caught, it's not getting treated. Something else I found interesting about this is the more advanced testicular cancer is, the more it starts to produce a hormone called beta-HCG. So most women at some point will know about this. This is the hormone that you use to check if you're pregnant. So when you go pee on a stick and it comes out positive, it's because it's detected this hormone in your body. This is not a hormone that we naturally produce. So there's been cases of men when they go pee on a stick and they get a positive pregnancy test. So I found that interesting. So the question is, do you need to pee on a pregnancy stick? Do you need to take a pregnancy test to find out whether you have testicular cancer? The answer is no. You don't need to take a pregnancy test to see if you got testicular cancer. There's an easier, basically a method that anybody and everybody should be using, a self-examination. So this plays a major role in the diagnosis and basically catching testicular cancer early. And basically, pun intended, it's in your hands. This is something that is up to you, and this is why awareness is very crucial. This was the main point of making this video, and I guess this makes it my first tutorial. And since I don't have my own testicles, I have my own homemade ones. I did this video yesterday and I used eggs, which are, I think, more anatomically correct to testicles. But I made a quiche using them and I didn't buy any more eggs. So today we're using lemons. So these are going to be your testicles. And this is my durag that I stick with. And this is going to be, just gonna drop them in there and create my own homemade testicles. And I'm going to show you how to do self-examination. It's very easy. First step, it's easier done in the shower. Since you're in there anyways, giving everything a scrub, just spend a few minutes down there and just, you know, sort yourself out. So here are my homemade testicles. Basically, okay, actually kind of looking at this, it's normal to have one that's bigger than the other one, and it's normal to have one that's a bit lower or higher than the other one. That's normal. So you start off with basically just with one testicle and you roll it around your fingers and your thumb, feeling the surface. So you're feeling the surface to see, are you feeling any hardness, any rough bits, any painful bits, anything that just doesn't seem normal to you. And you do that all around the testicle, and you do that to the other one as well. You're feeling around the surface, what can you feel? Then you check all those little pipes, and they're usually like together, and you rub them. They have a rubbery feeling, so you rub them between your fingers from the bottom to the top. And again, are you feeling any lumps, any bumps? Is it tender? Is it sore? And you do that to the other side. And that's it. That's your self-examination done. And this, like I said, it's a very crucial part of testicular health. And this is all I wanted to do. I wanted to show that it's a simple thing to do, and I also just wanted to make sure that there's awareness and there's knowledge, mainly about the risk factors and of the self-examination. That's it. I just wanted to say, fellas, check your balls. It's not that hard. But yeah, thank you so much for watching. If you have any type of concerns or you just want to talk about it, then yeah, just let me know. It's probably the only time I'm willing to talk about testicles in my DMs. But yeah, thank you so much for watching. I'll see you next time.